Mambo, ninafaraha kukutana nawe. Hi, my name is Amanda Horine. I am from Gannon University in Erie, Pennsylvania, but I'm originally from Edmond, Oklahoma. At Gannon, I'm in a 3+2 physician's assistant program where I get my bachelor's in 3 years and then complete my physician's assistant master's in 2 years. It's actually in my undergrad where one of my friends, Harry, told me about his travel program in Kenya through Elective Africa, and I decided, why not? I spent the day in internal medicine on my first day, which I think was really interesting, but I think the second day, surgery, was a bit more my speed, and for the rest of the week I stayed in surgery. The first day I was in surgery, I saw a urology case and then an open heart surgery, which was really interesting. And then I would say the most memorable case that I had throughout that week, though, was a spinal bifida case where it was a 6-month-old baby with spinal bifida, and just seeing their process of, starting to finish and how they're able to, cure certain diseases almost from the get-go from this baby's life was just absolutely incredible. And so I would say that was probably one of my more memorable cases. And then the next week, I ended up going to labor and delivery. And labor and delivery is a different speed, but almost similar to surgery. I saw a lot of vaginal births, but I also saw a lot of cesarean sections or C-sections. And I think that was overall a very, very cool experience. I saw a few sad things though, which I guess comes with the placement and everything. One thing that I would take away though from my time in the hospital, I would say, is definitely the compassion that a lot of the doctors and the nurses had towards a lot of the patients in their circumstances, because a lot of them were there unwillingly or there for something completely out of their control. And I feel like the doctors and the nurses were very receptive to it and very understanding and very communicative about how they wanted to approach certain situations to make the patient feel better. And I think that's probably going to be something that I'm going to end up taking into my clinical practice whenever I'm a physician assistant, is just how clearly they communicate what is going to happen, what to expect to happen, and how to communicate it effectively while also making sure that the patient is completely comfortable, which I think was a very important detail. And then in terms of excursions that we've done, we went to an orphanage, I'm pretty sure called Baby Life Rescue or something along the lines of that, where we just spent the day with the kids and we donated a few things to the orphanage. And I think that was a very lovely experience. Again, it's just one of the things that I feel like you don't really realize how much you need certain things in the moment until later, and then it makes you very grateful for the opportunities that you have later. Um, very grateful for that experience. And then on a very different note, we went to Holler Park as well, which is an animal sanctuary. They had a gazelle, 2 hippos, a few tortoises, a lot of crocodiles and snakes, and then giraffes. And we were able to hand feed the giraffes, which was a really, really cool experience. I really do hope that I get to experience more international medical aid experiences, such as my time here in Kenya. I think it's a great way to see other countries and travel and also leave a bit of an impact and hopefully leave it a little bit better than you came. I think the placement highlight has been meeting the other students and becoming friends with them. I think the past 2 weeks have meant a lot to me. I think I've really gotten out of my comfort zone. I think I've experienced a lot of new things that I just wouldn't have back in the States. And so with coming out of my shell, the new experiences, getting out of the comfort zone, I think this trip has done a lot for me. I would 100% recommend doing an international internship like this, but only with Elective Africa.